Now, Part 1, Parasitic Worm Infections. What are worm infections? Worm infections are caused by parasitic worms, helminths, residing in the human body, usually within the intestines, and consuming nutrients that are vital to the host. These parasites can cause malnutrition, particularly in children, and lead to a variety of physical symptoms. Worms are often contracted through contaminated soil, water, or food, especially in areas with poor hygiene and sanitation. Symptoms of worm infections. 1. Abdominal pain, discomfort or cramping, which can sometimes become severe. 2. Nausea and vomiting, a common reaction to the worm infestation. 3. Loss of appetite, reduced food intake, leading to weakness or malnutrition. 4. Perianal itching, an itching sensation around the anus caused by worm migration. 5. Visible worms. Worms may be seen in stool, vomit, or on the anal area. 6. Behavioral changes in children, itching or irritation, especially around the feet, discomfort that disrupts school activities, a lethargic appearance. Treatment of worm infections. 1. Albendazole. Form: tablet Almex DS syrup. Dosage: adults take 1 tablet or spoonful after food. Repeat the same dose after 7 days to ensure complete elimination. Effects: mild nausea or headache, rarely abdominal pain. 2. Mebendazole. Form: tablet solus syrup. Dosage: 100 milligrams once daily for 3 days. Effects: abdominal cramping or rare allergic reactions. 3. Pyrantel pamoate. Form: syrup melpin. Dosage: adults take 1 teaspoon daily after food for 7 days. Effects: mild dizziness, nausea, or diarrhea. Prevention: maintain proper hygiene by washing hands thoroughly before meals and after using the restroom. Ensure that food is cooked thoroughly, especially in areas prone to contamination. Wear footwear outdoors to avoid contact with contaminated soil. Regularly deworm children as advised by a healthcare provider. Part 2, topics on gingivitis and rickets, and Part 3, pneumonia, UTI, and comprehensive overview, will delve deep. Part 2, gingivitis and rickets. What is gingivitis? Gingivitis is a common gum disease caused by bacterial infection resulting from poor oral hygiene. It is characterized by inflammation and irritation of the gingiva, the part of the gums around the base of the teeth. If untreated, it can progress to periodontitis, a severe form of gum disease leading to tooth loss. Symptoms of gingivitis. 1. Swollen and red gums. The gums become puffy, tender, and visibly red. 2. Bleeding gums. Frequent bleeding occurs during brushing or flossing. 3. Persistent bad breath, a common symptom due to bacterial buildup. 4. Gum recession. Gums start pulling back from the teeth, making the teeth appear longer. 5. Discomfort or pain. Mild to moderate pain or soreness in the gums. Causes of gingivitis. 1. Poor oral hygiene leading to plaque buildup. 2. Plaque hardens into tartar, calculus, causing gum irritation. 3. Tobacco use. 4. Hormonal changes, puberty, pregnancy, menstruation. 5. Medical conditions like diabetes or conditions that weaken the immune system. Treatment for gingivitis. 1. Improved oral hygiene. Brush teeth twice daily with fluoride toothpaste. Floss daily to remove plaque from between teeth. Use an antibacterial mouthwash to reduce bacteria in the mouth. 2. Medications and professional cleaning. Mouthwash with chlorhexidine to reduce gum inflammation and bacteria. Tab amoxicillin and clavulanic acid 625 milligrams. Dosage: 1 tablet 3 times a day for severe cases of gingivitis. Side effects: stomach upset, mild diarrhea, or rash. 3. Regular dental visits. Professional dental cleaning removes plaque and tartar that regular brushing cannot eliminate. Rickets. What is rickets? Rickets is a childhood disorder caused by vitamin D deficiency. Vitamin D plays an essential role in calcium and phosphorus metabolism, crucial for healthy bone development. Inadequate vitamin D results in soft, weak, and deformed bones in children. Causes of rickets. 1. Insufficient vitamin D intake from diet. 2. Lack of sunlight exposure. Vitamin D is synthesized through skin exposure to UV rays. 3. Malabsorption conditions such as celiac disease. 4. Chronic kidney or liver disease impacting vitamin D metabolism. Symptoms of rickets. 1. Bone deformities, bowed legs or thickened wrists and ankles. 2. Growth delays, slowed height or delayed physical development in children. 3. Bone pain and tenderness, especially in the lower back, pelvis, and legs. 4. Frequent fractures, bones become brittle and break easily. 5. Muscle weakness, leading to poor movement and delayed milestones. Treatment for rickets. 1. Vitamin D supplementation. Cholecalciferol, vitamin D3, oral drops or injections to address deficiency. Dosage: children 1 year, 400 to 600 IUs per day. Children 1 year, 600 to 1,000 IUs per day. 2. Calcium and phosphorus supplements to strengthen bones and facilitate mineralization. 3. Dietary adjustments include vitamin D-rich foods, fatty fish, salmon, mackerel, egg yolks, and fortified foods like cereals and milk. Increase calcium-rich foods like milk, cheese, and green leafy vegetables. 4. Physical therapy and braces to manage bone deformities and support alignment during growth. 5. Preventative measures: adequate sunlight exposure for vitamin D synthesis, 15 to 30 minutes day. Regular nutritional evaluations in children at risk. Part 3, Pneumonia, UTI, and Comprehensive Overview follows next. Would you like to proceed? Part 3, Pneumonia and UTI. What is pneumonia? Pneumonia is a lung infection caused by bacteria, viruses, or fungi that Part 3, Pneumonia and Urinary Tract Infections, UTIs. Pneumonia. What is pneumonia? Pneumonia is a serious lung infection caused by bacteria, viruses, or fungi. It leads to inflammation of the air sacs, alveoli, in the lungs, which may fill with pus or fluid, making breathing difficult and reducing oxygen levels in the blood. Symptoms of pneumonia. 1. Cough, producing yellow, green, or blood-tinged mucus. 2. Fever and chills, persistent fever with sweating or shaking chills. 3. Shortness of breath, difficulty breathing, especially during exertion. 4. Chest pain, sharp or stabbing pain when coughing or breathing deeply. 5. Fatigue and weakness, persistent tiredness due to the body's fight against infection. 6. Loss of appetite, nausea, or vomiting may be more common in children. 7. Severe symptoms in infants or elderly, cyanosis, bluish lips, confusion, or severe lethargy. Hantra tests for pneumonia. 1. Chest X-ray, CXR, to identify the extent of infection and fluid in the lungs. 2. Complete blood count, CBC, to detect elevated white blood cells indicative of infection. 3. C-reactive protein, CRP, measures inflammation levels in the body. 4. Sputum culture, identifies the specific bacteria causing infection. Treatment for pneumonia. 1. Antibiotics for bacterial pneumonia, syrup Cefixime, dosage 10 mg per kilogram per day divided into 2 doses for children, e.g. 1 teaspoon for every 10 kilograms body weight. Side effects: diarrhea, nausea, or mild stomach pain. 2. Mucolytics and cough relief, syrup ambroxol, dosage half a teaspoon twice a day for children or as per weight, helps break down thick mucus. Syrup Miracov for dry cough relief. 3. Symptomatic treatment, syrup Napa, paracetamol, for fever and body aches. Dosage 10 to 15 milligrams per kilogram every 6 hours. Nebulization provides humidified oxygen and reduces airway constriction. 4. Supportive care, hydration, plenty of fluids to thin mucus and prevent dehydration. Adequate rest. Urinary tract infection, UTI. What is a UTI? A UTI is an infection in the urinary system, including the kidneys, bladder, ureters, or urethra. Bacteria, especially Escherichia coli, E. coli, are the primary cause. UTIs are more common in females due to shorter urethras, making it easier for bacteria to enter. Symptoms of UTI. 1. Burning sensation during urination, a hallmark sign. 2. Frequent urge to urinate, despite passing only small amounts of urine. 3. Cloudy or foul-smelling urine. 4. Pelvic pain, especially around the lower abdomen or near the pubic bone. 5. Blood and urine hematuria, pink, red, or cola-colored urine. 6. Fever or chills, when the infection spreads to the kidneys. Causes of UTI. 1. Poor hygiene practices. 2. Catheter use. 3. Dehydration leading to reduced urine flow. 4. Sexual activity or unprotected intercourse. Tests for UTI. 1. Urinalysis. checks for white blood cells, red blood cells, or bacteria in the urine. 2. Urine culture identifies the exact bacterial strain for targeted treatment. 3. Imaging tests. Ultrasound or CT scans for recurrent or complicated UTIs. Treatment for UTI, antibiotics. Tab ciprofloxacin 500 milligrams. Dosage 1 tablet twice daily for 3 to 7 days. Side effects: nausea, diarrhea, photosensitivity, or dizziness. Nitrofurantoin or fosfomycin for specific cases. 2. Pain relief. Tab Algin 50 milligrams for pain relief during urination. 3. Anti-nausea medication. Tab Omidon. Dosage 1 tablet 3 times daily before meals. Side effects: mild drowsiness or dry mouth. 4. Supportive care. Increase water intake to flush out bacteria. Avoid irritating foods like caffeine, spicy dishes, or alcohol. Closing note: both pneumonia and UTIs require timely diagnosis and treatment to prevent complications. Self-medication should be avoided, and medical advice must be sought if symptoms persist. Regular health checkups, proper hygiene, and healthy lifestyle habits are pivotal in managing and preventing these conditions.